I want to tell the birth story of my second baby. He was born 6 weeks ago, July 2025. He is here with me currently, otherwise we wouldn't get any filming done, but that's perfectly fine with me because I love the cuddles. I had a very positive unmedicated hospital birth, my second unmedicated hospital birth, and I do work at the hospital that I gave birth at. So I know the staff and know the providers, and I am a lactation consultant there, and I was previously a labor and delivery nurse there. So in my opinion, that definitely helps to have a positive experience because I'm very familiar, very comfortable, but I'm here to tell you that it is definitely possible to have a positive hospital birth and to have your preferences respected and honored. With my first son, I was induced after hitting 41 weeks pregnant. This time around, I was really hoping to go into spontaneous labor. I didn't want to be hooked up to an IV. I didn't want to be hooked up to continuous monitoring. I wanted to just experience my body doing what it wanted to do and to not rush baby out before he was ready. So that was my goal, and I did hire a doula this time. Last time I did not, for financial reasons, because it was our first baby and we just had so many things to buy and so many things to prepare before welcoming our first baby. This time I did prioritize that, especially because I didn't have as many baby items to buy. So that was an investment I did make. I am a doula myself, and as a nurse, I also know the value of a doula being present. It is so important and has been shown numerous times that having continuous support by another woman during labor improves outcomes, it decreases pain, it improves birth satisfaction, and decreases birth trauma. So it was very important to me that I had a doula this time. I also felt like last time I wasn't able to get out of my practical brain, and I was kind of doulaing myself and watching the monitor, even though I had an amazing team and I had friends as my labor and delivery nurses and my favorite doctor. I still was watching the monitor, paying attention to everything instead of just going into my, animal brain and just letting labor unfold without thinking about it. This time I had contractions and like a lot of pelvic pressure, like pressure on my cervix essentially, for weeks leading up to the birth of my son. I was working up until I went into labor, so I would be on my feet a lot. I could definitely feel with exertion, and even sometimes when I was resting, I would get contractions. And I did experience Braxton Hicks for quite a while, but then they did switch over to more uncomfortable contractions and lower down, more like period cramping with that pressure. So I felt like I was dilating in the weeks leading up to birth. So although I was kind of skeptical if I would go into labor spontaneously before 41 weeks, I kind of had a feeling I would, because I did have some of those symptoms that I didn't experience last time. It was a Saturday morning and I had work at the hospital. I actually work at 2 hospitals, so it was not the hospital that I delivered at, but it was the other hospital I work at. I was driving to work and I was having pretty consistent contractions every 15 minutes. I was considering if I should go to work or call out because it kind of felt like this could progress into labor. I ended up texting my doula and letting her know, and she encouraged me not to go to work, but I decided I was going to anyways because I'm a little stubborn and I'm one of those people who doesn't like to call out unless I'm on my deathbed. So I decided I would go in, and if things got more intense, I would let my coworkers know and head on home. Worked my work day. It ended up being not that crazy busy, so I left a little bit early. I went home and my son actually had a fever. He's still nursing, so I came home and started nursing him for hydration and comfort. He was nursing a little bit more because he wasn't feeling good. And then my husband, who had been with him all day, started to not feel good. So my husband went to take a nap on the couch while I was hanging out with our toddler, and I started getting pretty consistent contractions again. This time they were about 5 minutes apart and getting more intense. So I texted my doula again and let her know that things were happening again. I got my toddler to sleep and comfortable. And then I got up and I made something to eat. I did a little bit of tidying, took the trash out, all of that good stuff. I noticed when I was taking the trash out that the contractions were actually causing me to breathe through them, and I had to stop walking to have a contraction at one point. So I knew that things were different. I was hoping not to have my son that day or go into labor with him that day because my toddler was not feeling well. I had never left him overnight, and especially when he's sick, he just wants his mommy. Like, who doesn't want their mom around when they're not feeling well? So I was really nervous to go into labor and leave him while he was not feeling good. But labor happens when labor happens. Babies come when babies want to, and that's just the way it goes. After my husband and son woke up, I realized that if I was going to keep nursing, I was probably going to go into labor. As we know, nipple stimulation releases oxytocin, and oxytocin increases the intensity of contractions. So I was trying to limit how much I was nursing our toddler, just trying to get through to bedtime, comforting my toddler. Kind of told my husband that he should pack his bag, get prepared in case that this was the real deal, which I was starting to be more convinced that it was. I did bedtime with my toddler. I decided to lay down with him. Probably went to bed around 9. At midnight, my son started like crying out because he wasn't feeling good. So I went to turn over to see what was going on, and my water broke. You can feel it in my experience. It's a pop, and then a few seconds later, the gush comes. When your water breaks, that's usually what happens. I called for my husband and I was like, my water just broke, unless I just had like the biggest pee of my life, but I knew that was not the case because I felt the pop, and it's just a sensation that is pretty obvious in my experience of my 2 births. So I sit up and the water's just gushing. So there was no denying that it broke, and of course broke all over my bed. So I get up and start getting ready because with my first labor, I was induced, but it was 10 hours from start to finish, and I didn't really push. I had fetal ejection reflex, so I was nervous that things were going to go quickly this time, being a second baby, and being that my first birth went pretty quickly as well, given the circumstances. So I got up, changed, went to the bathroom, put a pad on to confirm that things were going to continue leaking, sent my doula a picture and told her that my water had broken. She called me to see how things were going and if I was having contractions, and immediately the contractions were intense, like way more intense than they were before. Like, I was sleeping, and I don't know if I was having contractions during my sleep, but they weren't bothering me if I was. So immediately things got really intense. I started shaking from the hormones and feeling nauseous. I started dry heaving. So I told her, yeah, I'm pretty sure this is happening. I don't think we're gonna have issues getting the contractions going and consistent now that my water is broken. We were making a plan of when we were going to meet up. I decided I would let my provider know that my water had broken and that I was having contractions. I had also called out of work Sunday at the place I was delivering at 10:30 at night, and my water ended up breaking at midnight. So definitely the right move to call out. While I was getting ready and cleaned up and everything, I called my provider. It was the on-call answering service, so they picked up. I let them know what was happening. They had the provider call me back. She recommended that I go straight to the hospital because of my history of a pretty quick birth the first time around. Called my in-laws, told them my water broke and to come over as soon as they could to be with my son. Of course, the whole time my son was awake and freaking out because it was the middle of the night and he was tired and not feeling good. So I was trying to tend to him while I was also having contractions and trying to get ready to go to the hospital. My husband had literally just finished loading the dishwasher and was about to go to sleep when my water broke. So he didn't get to sleep at all, unfortunately. Once I talked to the provider, I called my doula back. I let her know that we were gonna head over to the hospital once my in-laws got to our house. We finished packing everything up. My in-laws arrived. They live about 20 minutes away. I said goodbye to my son. I was bawling my eyes out because I didn't want to leave him, and I was so nervous how he was going to be, but he ended up doing fine. We drive over to the hospital, which is about a 10-minute drive, park over near the emergency room since it was nighttime, go in, get checked in at the hospital ER waiting room. Doula met us at the hospital. She actually got there before us, and she was waiting in the parking lot, which was amazing. I was so grateful that she was there and that I didn't have to do anything without her help. She came in with us. She was doing hip squeezes in the ER. I was like leaning over one of the chairs in the waiting room, getting through my contractions, swaying. Transport finally arrived. She was walking us up to labor and delivery, and I have an elevator phobia, so I do not take the elevators. I always take the stairs. And she was like, nope, we're taking the elevator, just close your eyes. And I fought them for a good, 10 minutes maybe while I was having contractions. And she was telling me she didn't know how to get up to labor and delivery. And we were in a different part of the hospital because we came in through the ER. So I was like, I'm not 100% sure, but I think this is the staircase. She was like, well, no, you're just gonna have to take the elevator. And I told her she had to find someone who knew where the right staircase was because I wasn't going in the elevator and I would have a baby right there. So she had somebody else come over. He escorted us upstairs. He was super sweet, encouraging me the whole time, telling me I had it, and was super understanding about the elevator stair situation, which I admit is very annoying, but it is what it is. I didn't want to be having a lot of anxiety during my labor because that can stall contractions, and I didn't want to risk getting stuck in the elevator. So we get up to labor and delivery. I am having contractions in the hallway. My doctor was not there yet. The other practice's doctor came over and heard me moaning through them and rushed us over into our room. The staff were kind of running around thinking I was about to have a baby any second. Got undressed, they got my IV in, they started getting me hooked up to everything. I ended up getting a cervical exam. I was 4 centimeters, which felt kind of crazy because things were definitely intense. It was really funny because I kept saying during the contractions, owie, 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 which cracked me up every time because tell me you have a toddler without telling me you have a toddler. So I was leaning over the bed, swaying. I would do this thing where I would like get on my tiptoes, like one tiptoe to kind of like tilt my hips. So interesting how your body just intuitively does things to get baby to engage and to get where they need to go in your pelvis to be born. Your body will just do its thing if left alone. I really wanted to get in the shower for pain relief. I did my intermittent monitoring for about, I think it was like 20 or 30 minutes. I ended up going in the shower after the monitoring. That was so nice. It's so relieving to have water during labor. Hydrotherapy is super effective. Stayed in the shower for quite a while, was getting lots of pressure, felt like I could be making some decent progress. Ended up getting kind of tired and wanted to be in bed, so I got out of the shower. I was being monitored intermittently throughout, like every few hours. Got checked. I was 7 centimeters and I was feeling a lot of pressure, so I was kind of discouraged because it felt like I could push the baby out at any time, but I still had a ways to go. At this point, you're in transition, so it does start to feel pretty intense, but because my water was broken, there's no barrier there and baby's head is just pressing up against your cervix, and that can feel pretty intense. This happened with both my births, that my water broke pretty early on. So for me, the pressure is the most intense part, not the contraction discomfort, but just the pressure of the baby's head on my cervix. I labored in the bed, mostly on my sides. I did the peanut ball. I did a pillow between my legs. I was using a comb, squeezing a comb for pain relief, swaying, doing all the things, talking with my doula. She was encouraging me. Started to feel lots of pressure again, or more pressure, and like I needed to push. So I had them check me again. I was 8 centimeters. Oh my gosh. There's nothing worse than feeling like you need to push and not being at the point of pushing yet. And I was nervous to push against my cervix, not have my cervix be ready for pushing it, swell my cervix, and then have more issues and have my cervix not be able to fully dilate and have the baby not be able to come through. Sometimes if this happens, it leads to a C-section. So I started to get a little panicked because it's really hard not to push when your body is involuntarily pushing. So it took quite a bit of willpower to relax during the contractions and not clench and not push. I ended up like moving back and forth with the pillow in between my legs, and afterwards my doula was laughing and joking with me.
It's funny, that's how I described it.
It was accurate. It was accurate. She was kind of giving it the business.
Because I was trying not to push and I was trying not to clench. It's a very difficult place to be.
That's the only way that I could get through the contraction without clenching, which we know baby's not going to come down if you are clenched and tense, and without pushing. So that was my solution to that ordeal. I did find a good rhythm where I was surrendering to the intensity and able to rest in between. The contractions actually spaced out, which I didn't experience the first time being on Pitocin. So I started to get a little nervous that things were going to take longer, but I also know the physiology of birth and that this is what happens sometimes before baby comes, to give mom a little bit of a break and to let baby recover in between contractions. I went to the bathroom to empty my bladder. It was like unbearable to sit on the toilet. And I came back and I felt like I really needed to push. Nurse checked me again. I still was not ready to push. I think I was like 9 or 9.5 centimeters. My doula recommended that we use the rebozo to shake the apples, which is when you take the rebozo and you go like this around the hips and the butt to loosen up the fascia and to help baby get into a better position. Literally, as soon as she did that, I was ready to push. My noises changed. It was undeniable that I needed to push. So baby was coming. They called the doctor. The doctor came. She was telling me not to push because she dropped her gown on the ground and she was getting a new one. So she said, wait, don't push. My nurse was like, do what you need to do. I will catch the baby if necessary. The doctor also said that I should get onto my back because it was difficult for her to assess what was happening in the hands and knees position. And what is there to assess? The baby's coming out. That is all you need to know. My body and my baby know what to do. Let's do this. So I got my left leg up, like I was in like a runner's position to make more space for baby. That's what felt intuitively right. Was pushing involuntarily, like there was nothing stopping me. At that point, I was screaming, no longer finding my zen during the contractions. Felt the ring of fire, which is just something that you never forget. People say like, oh, you forget the pain of childbirth. I never forget that sensation. It's very clear in my mind, the ring of fire. Felt that, pushed through it. You should, in order to not injure yourself more than you need to, rest and breathe through and let baby come out slowly so things can stretch and you have less tearing. But that's never an option for me. So pushed, baby's head came out. Then you feel the release of the rest of the body. The doctor was like, what do you want me to do now? Because she's not used to delivering in hands and knees position. And my doula was like, you just hand her the baby. So put the baby between my legs. I grabbed baby, brought him up to my chest, was in shock, obviously, of what had just gone on. And I flipped over with him. We got our skin to skin. He was a little bit stunned from the quick birth, so he was like not breathing as great as he could, but totally normal. They just need to transition to outside life. Being on your chest, doing skin to skin will help regulate all of that. After a while, the nurses did ask if he could go over to the warmer so they could take a little look at his breathing and have the neonatal nurse practitioner look at him, so I did say that was okay. They took him for a few minutes while I was getting situated in bed. They brought him back over to me to continue with skin to skin. He ended up being fine, transitioned perfectly. I ended up having a 1st-degree tear, so the doctor was stitching that up, and there was also one area that didn't require stitches, so I had like 2 tears. Stitching is always so uncomfortable. Having an unmedicated birth, no big deal. Stitches, postpartum, not for me. So anyways, I could feel the stitching. I needed to get more numbing solution because I could feel the sharpness of the needle. Finished that up, got all cleaned up, started breastfeeding within the hour, wrapped up with my doula. It was beautiful and amazing. I got my spontaneous birth without needing to be induced. It was midnight when my water broke, and he was born at 5:02 in the morning, so about 5 hours from water breaking to baby born. Pushed for, I think, a few minutes. Like, basically, I just have fetal ejection reflex, and they just kind of come out themselves. But I did push like a few times intentionally to get him out. I do think it's pretty funny because I have experience in labor and delivery and also work at that hospital in lactation, and the doctor was still kind of treating me like I was insane for my birth plan, which included birthing in hands and knees, no postpartum Pitocin, and delayed cord clamping. So I did do delayed cord clamping until the cord was no longer pulsing and that it was white, so baby got all of his blood. I think those were the only things. Pretty standard, but it was like in my notes, like patient reveals extensive birth plan, educated on risks. She was treating me like I was putting us in harm's way from wanting to birth upright. But anyways, it all turned out good, and I had a great experience. I just wanted to share my experience as someone who has had 2 positive unmedicated hospital births, to share that it can be done. And my biggest tips are to advocate for yourself, be fully educated and prepared, have a good support team, get a doula, have a supportive partner. If you don't have a supportive partner, like husband, boyfriend, whatever, maybe have your friend or your parent or whoever is going to be supportive to you to be present, and choose providers that are supportive of your birth plan. I chose the best option for providers based on the location that I was birthing at. It wasn't super crunchy and low intervention by nature, but I advocate so hard that it doesn't really matter who is delivering the baby, because the baby will be born either way. Thank you so much for watching. I hope you guys have a wonderful day. If you enjoyed this, please subscribe and stick around, and I will see you next time.